All right, so Jason will be joining us in about 10 minutes. This guy is actually the guy that worked on one of my birds. Well, technically, it's one of my son's birds, but long story. I guess I'll sum it up here. If you're listening to the podcast, you've kind of heard me touch on this before. Just over a year ago, maybe a year and a half, I had a sickness come into my loft, and it was a real head scratcher. I originally thought that it was something like salmonella or coccidiosis because of the way the droppings looked. And, I'm looking at all the images online of what the different, those posters of bird droppings and what these bird droppings mean. And, scratching my head out when I put them on a 4-in-1 powder treatment that was for paratyphoid, coccidiosis, salmonella, and E. coli. I don't know. So it was 4-in-1. So anyways, once I put them on that, and birds were just dying on me, just dead, everywhere I looked, dead birds. So I thought, okay, it's none of those four things because this 4-in-1 powder didn't do it. So then I start really getting into some obscure kind of diseases, reading a lot of different pigeon health books, and, online answers were different than book answers. And it was just terrible because I kept losing birds. I lost birds that were, you're working on a family and, you got dreams of what they're going to be and stuff, and I'm losing all of them. And Gary, he was kind of a mentor for me, especially at that time, and he still is, but he really kind of pushed me because I'm reading the books, and it even says in the books to, go through the steps, try to diagnose it, try to cure it if you can. And if you can't, then take that bird that is dead and take it to a pathologist and have them study the bird. And Gary was like, you should really do this. What else can you do? You've already done everything else. And then I started looking, and I called every vet. I called every bird store, just having a heck of a time finding anybody. The closest I had at the time, someone was like, maybe I'll do it for like $1,000. And I could tell they were just not wanting to do it. Eventually, I don't know how I got down to it, but I found out about a university in the city of Phoenix in Arizona, and it's about a 3-hour drive. And they said, as soon as the bird dies, don't freeze it because that damages the cells. Pack that thing up and bring it down to us, and it has to be within a certain time frame. So just waited. Sure enough, another bird died. So I packed it up, drove it down to Phoenix. It was about a day trip just to drive there and back. But after, I don't know, a month or so, I got a whole workup on what it was. Turns out it was just a severe case, coccidiosis. And when it was so severe, a 4-in-1 treatment just doesn't have enough of any specific medicine to treat any of those 4 things it claims to treat, especially if you have an outbreak going on. And even if you read about coccidiosis, the survival rate, it's not that terrible. But I lost everything. I lost all of my birds. And my son lost his birds too. That was hard for him. He was a kid. It was rough. But once I figured out what it was, I talked to Chris, and Chris is like, cord is how you treat coccidiosis. I had a few birds left to put them on cord, and that was it. I literally haven't lost a bird, since. I wish I would have done a more specific treatment when that happened. But I'm glad that I was able to find this university down here, find this pathologist, and I'll tell you, I got a 6-page report on that bird, and it is incredibly. They got pictures of the slides of the different colonies and stuff that they took, the tissue samples, and it's beyond thorough. Wrapping it all up, it solved the problem. This was a really bad outbreak. I was losing my mind. It took me, I hated it. Like every time I walked in my loft, I'd be looking at the ground, just there, dead pigeon down there. It was horrible. And finally finding a solution to it and getting back into it, man, I'm so happy. We got birds breeding right now. We're back in the cycle of life. And actually, this guy that we have coming on here, Jason Struthers, he's actually the guy that did the pathology on our birds. And I spoke to him about it coming on and talking about that and the importance of it and what they can do. And I'll tell you, it was, I don't know what you guys are going to find if you have to go through this, but it was only $75, and they'll study 2 birds for you. And I'll tell you, they break it down. Very, very thorough report and everything else. But I feel like I've been talking for about an hour now, so.
Is he here? Is he in the waiting room, Phil?
Yeah, he's in the waiting room right now, but.
Oh, man. You better let him in and you're running out of stuff to talk about.
I know, right? Yep, I'm done. So, hey, Jason, how are you doing?
Hey there, I'm all right. How are you?
Good, good. Thanks for coming on with us.
No problem.
This is the All About Pigeons podcast. I'm Phil,
I'm Chris.
and today we have with us Jason Struthers. He's an associate professor in veterinary pathology, Department of Pathology and Population Medicine at the Animal Health Institute at Midwestern University. A little bit of background on Jason. He got his doctorate of veterinary medicine in 2011 from the University of Montreal, his master's in anatomic pathology in 2013 from University of Saskatchewan, and completed his anatomic pathology residency at the University of Florida. Is that all correct, Jason? Am I reading that off right?
Yeah, you did a good job there, Phil. Thanks.
He's also an editor in the third edition of Pathology of Pet and Aviary Birds and contributed the chapter on doves and pigeons. So that's pretty interesting. And I was saying earlier that you're the guy that helped me figure out my mystery disease that was going through my loft, and I really appreciate that.
Yeah, no problem.
Worst case scenario, I guess, when it came down to it, trying to diagnose on my own and medicate on my own and still just having these mystery things happening, finally came down and I was able to find you down there and find the university. It stopped. I figured out, you told me exactly what it was. You even told me some other things I didn't even know was going on from the actual something with the dermatitis. He had some sort of, mites, which I thought I was taking care of. There's a lot of other things too. I mean, that I gotta say that report that you gave me was very in depth and it was amazing. I was blown away with it. I was telling one of the guys in the pigeon club about it, and he asked me to bring the report to the show this weekend so he could take a look at it, because it's pretty incredible. You guys really don't hold anything back. You do a really good and thorough job. And once I figured out what it was, I didn't lose any birds after that. I put everything on cord and got rid of the coccidiosis, and everything was happily ever after that.
Did you find any performance enhancing drugs in the bird system?
He doesn't have to answer that.
Okay.
Did I find any performance enhancing drugs in his birds?
He said he had pretty good birds. I was just checking.
They were in good body condition for sure when I examined the one bird he submitted. But yeah, Philip, thanks for that feedback. I mean, yeah, we definitely try to be as thorough as possible, because there's nothing worse than examining a case or working through a case and not having a good understanding of what could be happening. And so, in other words, not being able to help the submitter, that's the ultimate goal.
Yeah. And I remember, you guys definitely asked me a lot of questions about what was going on. Because I had multiple lofts, how far apart are my lofts? Because that never really crossed my mind either. I'm like, am I cross-contaminating? Because it was driving me bonkers, I went through and cleaned out a whole loft, and then birds are still dying, and it was still getting there somehow. And even just the questions you guys asked kind of opened my eyes up a little bit about the I guess biosecurity is what it is.
Yeah, for sure.
I had such a hard time finding you. I called every bird shop and vet up, in the state, man. And I forget how I ended up getting down to you. How could somebody, what would be the easiest way to find a pathologist if someone's having this issue and they're trying to find an answer to it?
Yeah, that's a good question. We're a relatively new college of veterinary medicine, and so our diagnostic pathology service is not as well known as potentially some diagnostic services like in other states. For example, like in states like California and in like Cornell University, their diagnostic systems are a little bit better known. In Arizona, there's a state lab that exists in Arizona that's down in Tucson. We're a private institution, but we have a diagnostic service that is open to all clientele. And so, people just, I guess, Google or look up veterinary hospital or veterinary teaching hospital or diagnostic veterinary service in Arizona, there's a good chance they might come across the diagnostic pathology center that we have here in Glendale. But a lot of it's kind of word of mouth, and veterinarians sort of become aware that this service exists. We get a lot of cases from cat and dog veterinarians, for example. And so, if people own birds and happen to own cats and dogs simultaneously, there's a good chance that that veterinarian may suggest, hey, you could send your birds to the diagnostic lab down in Glendale, Arizona at the College of Veterinary Medicine. We do have advertisements. Actually, they're, I don't know if you've been to the airport recently, but sometimes we advertise, not necessarily the Diagnostic Pathology Center, but Midwestern University. And so people might find us that way. But, unfortunately, a lot of it is just Google searching and talking to veterinarians, clinical veterinarians who may certainly be able to direct a client.
I think what would have helped me is if I was more keyword specific on pathology, because that's what I was looking for. But
Right.
I was really focused on like, maybe I just need to type in like, bird or aviary, and I was really just trying to go that route. Like I said, I was even calling bird pet shops and stuff, trying to find out where to go to on this.
The thing is with our diagnostic pathology services, we don't work directly with clients. We have to work with a veterinarian that clinical veterinarian has a built relationship with the client. We won't be working directly with aviaries or pet stores, but we will be working with the veterinarians that oversee those pet stores and aviaries. For example, we do get materials and cases from places like PetSmart and Petco, but the thing is we're working with their veterinarian and not like the storekeepers, for example.
So even out of sight of like an outbreak, like what would be some of the other benefits of, having a full workup done on a bird that is passed, even if it's just, a 20-year-old bird or something like that? I mean, you could still probably get a rough idea about like your overall flock's health, right?
Yeah, well, that's a really great question, Philip. And after I finished my residency in Florida, I spent a year as a pathologist at Disney's Animal Kingdom that's down in Orlando. And one thing, I've always been interested in wildlife diseases, exotics diseases, and a lot of bird pathology and bird diseases as well. And one of the things that the zoological institutions are doing really well is they do surveillance. And so everything in their collection that dies or that is euthanized humanely undergoes a full postmortem examination, even though the animal might have been euthanized after a long life, and it was euthanized because of maybe joint issues and quality of life issues. They'll still do a full postmortem examination. And the benefit of doing a full postmortem examination ultimately is you get to understand some things that might be affecting the animal, but like subclinically. And what I mean by subclinically, that means that it's an infection or a disease process that the animal is not being symptomatic about. You have a loft and you have a prize loft, and you want to just be sort of on the top of sort of ahead of any potential diseases manifesting in your loft or nutritional issues manifesting in your loft. The best thing to do is when an animal or a bird dies, sending it for a full postmortem so you can get a sense of what other things this animal may have that you don't even realize it. And I think a great example that you introduced the segment with was the mite infection. The mite infection you can't see with the naked eye. And so the only reason I was able to detect that was microscopically. I could see the mites when I was looking at the skin of the bird you submitted. And only then was I able to say, hey, you do have an ectoparasite burden in your population. Whether it's causing a lot of problems or not, it's still something that maybe you need to keep an eye on. And sure enough, you acted in consequence, and it might have helped decrease the morbidity in the loft. So yeah, absolutely great question. I mean, where someone has the appropriate means, I would be doing a postmortem on everything that died. Obviously, there are times when you want to activate some diagnostic interventions and activate some further investigation into what's going on in your loft. And that's when you have a spike in your mortality. That's exactly what you experienced, I think, Philip, is when you recognized that there was some birds that were ill, birds were dying. Obviously, this is out of the realm of normal. So you activated your sleuthing skills, and you were able to find me. So.
It was, like I said, it was bad. I couldn't figure out what it was. Trying to diagnose on my own wasn't working. And, the mites thing was really interesting because I get into a habit of, I do a dip of permethrin. I do the permethrin and I put them in a bucket. I dip on my birds once every 6 months, and I don't see like the big lice because that's what I'm looking for, holes in the feathers and stuff like that. But the stuff that you were talking about, I was like, okay, well some people were saying ivermectin, so that way it can come, from the inside out, and it will just get rid of all that stuff. But that's, because we even kind of talked on emails back and forth where it's like, that could, the birds are just having to fight this one more thing, pulling energy off of them, and being able to take that out of the equation too. Because I was like, well, coccidiosis isn't supposed to have this high of a mortality rate, but it was pretty severe. You actually put like the size, this report was incredibly thorough. The size of the coccidii in there and stuff, and I was like, wow, this is a pretty bad case of coccidiosis that's going through my stuff right now.
Yeah, for sure. I mean, like as you mentioned, like lice is another kind of group of ectoparasite, and so those you can see with the naked eye generally, but mites are far too small. I mean, we're talking about, sort of the head of a pin almost. You can't really see them too well at all. So
now, when I looked up the type of mite that it was, we were talking about it when he first got the report back from you. It comes back to spider mites. Is that right?
Yeah.
Are you familiar?
There are lots of different genera of mites. I don't know that I would say it was a spider mite. There's many different genera of mites, and histologically, I can't really, determine that. I guess there's some feather mites and some skin mites, and there's lots of different varieties of mites. Okay,
I was just trying to understand it better.
Yeah, so it says here on skin, I'm going to probably pronounce all this terrible. Dermatitis and folliculitis, claudius, granulocytic and mononuclear, moderate to marked chronactive with stratum corneum and hair shaft arthropods, favor mites.
Yeah.
And so, I mean, I literally was just I had to like Google almost every word.
Just when you Google favor mites, it comes back to the spider mites. That's what it was.
I think that's what we did. Yeah.
Oh, okay. Yeah. So when I said I appreciate that follow up there, feedback. So favor mites, as in like I can tell it's an arthropod, and I think it's probably a mite. In other words, I'm favoring that this is probably a mite infection.
Okay.
Not like the name of the mite is called
type.
favor mite.
Okay.
That makes
gotcha.
sense? Yeah.
That clears it up right there.
Yeah. Spider mites. Yeah. I mean, I think that's a pest, plant pest, if I'm not mistaken. But the thing is, we have limitations with histopathology, right? So our limitations are, as we've just kind of broached it here, is I can tell you what it isn't. I can tell you kind of sometimes just the general group of things, but that's all you need to know really in some instances like that. It doesn't really necessarily matter exactly what mite it is. Knowing that it's a mite allows you to implement a treatment that would go after all the different mites. Does that make sense?
Gotcha. Yep. Yeah. Makes good sense.
And you can test, I mean, for if it was PMV or salmonella, like that would be spotted as well, right? I mean, because we talked about that in the emails, because you look for the signs that are common if the animal had PMV or salmonella, or if it was a virus sort of thing.
Yeah, no, that's exactly right. So I mean, when we're doing the full post-mortem, so basically, maybe just so people understand the whole process, we receive the bird, and I do a full external examination. Then I basically dissect the bird, open up the bird, look at all the systems. And so it's very meticulous, and then as I'm looking at these existing systems, for example, I'm looking at the lungs, I'm looking at the air sacs. And if I start to see things like inflammation in the lung, inflammation in the air sac, that might prompt me to sample that to send it off for culture, for bacterial culture. If I started to look at the pancreas and it was really abnormal looking, that might warrant testing for paramyxovirus, which is what we were suggesting, pigeon paramyxo. And so there are things, there are clues, really. Like being a pathologist is kind of like trying to be a detective here, to sort of make a little investigation and figure out, what could be happening, and sort of ruling things out as you move through the case. And I would save some samples fresh that I could then, send for testing. And then all those tissues that I take, some of them go in formalin, they get fixed, and then I make glass slides with them. So I look at the tissues histologically, and then I can see the lesions histologically, which might be more consistent with like a viral infection, or might be more consistent with bacterial like Salmonella or E. coli, or it might be more consistent with a parasitic infection like Coccidia, which was the case of your pigeon.
Not trying to be morbid or nothing, but we all raise pigeons, and part of raising pigeons is, whether it's a sickness or anything else, is a pigeon will die. And I think it would be beneficial for anybody to have one get looked at every now and then, just to see what's going on, because you never know about, like, I didn't know about these mites. And it wasn't just that too, like, just because you did it was like so thorough. I mean, like, you gave me like a 6-page report here, and if there was anything else wrong with any of the bird's other parts, it's digestive or whatever, that would have been a red flag for me to look into, because there is so much stuff going on. And pigeon fanciers can definitely get a feel for how their birds are, if they're handled a lot, and if they're not just inundated with 500 birds and something like that. But if they're really out there with their birds, they can get a feel for it. But a lot of the times, there's stuff that you can always learn. And just for the overall health of the flock, the loft, I can't believe it was $75 for 2 birds. So, I mean, I only had the one at the time, but I was really far away, and I just wanted to get the bird down there. And of course, I think the reason you have more than one bird would helpful, because if you had 2 birds deal with the same issue, right, then it would be more of a nail on the head. You can tell exactly what's really going on.
Yeah, that's another great comment with herd medicine. So I would consider pigeon raising as a kind of a herd medicine situation, or a loft medicine situation. The more the better. In other words, we're trying to look for trends, common things between the birds that might be representative of really the underlying culprit. Because sometimes it can be, some diseases don't manifest very well grossly when you do the gross exam, or histologically. And so, like, I'm thinking of like immunosuppressive viruses, like maybe like a circovirus. And so, if you examine 5 birds and all 5 birds have different things, you might want to investigate into a virus that is affecting all the birds simultaneously, and it's causing them to have a suppressed immune system, so they're all being infected by various opportunistic, normally benign conditions in the environment. Touching on circo for a second, I mean, there are things you can look for that suggest circovirus is there, but other times it might not be very evident. And the importance of sending in multiple birds, it can't be understated. I mean, so when I was a veterinary student, a lot of my externships were actually poultry medicine. I actually had a lot of interest in poultry medicine, which is a herd medicine situation. And when poultry producers recognized a spike in the mortality, they would call the vet over, and we would walk through the poultry barn, and we would listen for sick birds. And when we found a bird that was sick, even though that bird was alive, we would euthanize that bird so we could get the freshest samples, and we would euthanize a couple live birds that were sick. And then we would also examine a bird that had recently died, in order to best understand what is affecting the whole flock. I know that might be difficult for some people who own pigeons to decide to euthanize a pigeon, but the thing is, euthanizing a sick pigeon may ultimately save the rest of the flock, rest of the loft. Yeah, something to consider.
Yeah. Oh, I mean, that was brought up to me when I was talking to the lady down there about, well, you could euthanize one and then bring it in. And I was like, well, I've already lost everything. And, then it was at the point where I didn't know what it was. And I was like, well, I don't want to just keep 3 birds if it's a virus thing. And then every time I get new birds, they're carriers, and it just keeps going and going and going. If I could have brought 2 down, I totally would have. But we kind of got lucky with, when you gave me the report, I was like, okay, I'm going with coccidiosis is what's going on. And I spoke with Chris, and he was like, this is how you get rid of that. Put it on him, and dude, that was it. Like I was saying, I'm back into breeding again. My birds are happy and healthy. I'm going to start doing the ivermectin, because some guys are saying that's really good with like even the small mites that you can't see, because it'll go through the whole body, whereas I'm dipping with permethrin, and that obviously wasn't doing it. And some guys use that mule team in the bath water and stuff like that. So
Borax.
borax, yeah, borax.
I got a question.
Sure.
Avian flu. Are pigeons prone to it?
That's a good question. And they seem much less susceptible than many of the other bird species. That's the current impression. We're dealing with a very strange strain at the moment. That H5N1 Eurasian strain is causing some pretty catastrophic things in not just birds, but in mammals, which is not really typical of what avian influenza does. So that being said, it's not off the table, but generally the impression is that columbiforms, or columbidae, the family of doves and pigeons, seem to be less susceptible to avian influenza. That being said, I would always implement like the most amazing biosecurity I could for my loft if I had a loft.
Absolutely.
Yeah, meaning, if you have multiple lofts, I would even dedicate utensils and boots for one building, and then a different set of utensils and boots for a different building. And I would always tend to the most susceptible individuals first, so typically the youngest ones, and then finish with the oldest ones, so that you're not bringing in some subclinical pathogens from the oldest ones to the youngest one. Does that make sense?
Oh, absolutely. That always seems to come up when we're talking about doing the postmortem. Folks are worried about avian flu. So with that, I'll ask you, do you have anything that it's a mandatory reporting?
I mean, avian influenza would be a mandatory reporting if it was diagnosed in any bird, including a columbiform. The pigeon paramyxovirus, it's a paramyxo that's specific to pigeons, but that might be reported more to the wildlife agencies and not the U.S. Department of Agriculture. Mycoplasma gallisepticum is reportable. Pasteurella multocida is reportable. Not reportable within 4 hours, but within like the month. So there are a few, and the ones that are reportable are typically the pathogens that could potentially be transmitted to the domestic poultry industry.
Gotcha.
Like Erysipelotrix russipathiae, that probably would be reportable as well. Chlamydia psittaci, also known as like parrot fever or ornithosis, that would be reportable as well due to the zoonotic potential. So the chance that
transfer to humans.
Infected. Yeah, exactly. Mm-hmm.
Yeah.
And that's one that I've diagnosed before, not in domestic or not in pet pigeons, but in wild doves and pigeons. So it's a common organism, and it's one that could easily infiltrate a loft if you, for example, allowed access to wild birds.
When I had this thing going through my loft, you were asking how my loft was set up, if I had sparrows or ringneck doves flying in there and pooping all over inside the aviaries, which they can land on the top, and absolutely in that situation that could totally happen.
Well, that's what was making my chickens sick. They were pooping in their water.
Yeah.
It was out in the open. I'm pretty sure, they were getting everything that the wild birds get. So it's got to come from somewhere.
Yeah. So really, like, a good loft design would ideally be built in a way where sparrows, like, I have aviaries that are just caged. So if they're laying on the top and then their droppings fall down through and hit the same spot where the pigeons go, then that's a problem right there. What about people who are doing like pigeons and in one loft, and then they have a chicken coop, and they're doing quail or something in some other area? Like, is there just like you're saying, to have a pair of boots for one and tools for one? Is there because they asked me how far apart my lofts were, like, so is there like a safe distance, or is there a distance where your lofts are too close and that could cause an issue with spreading disease too?
I mean, that's a good question. I mean, ultimately, the greatest distance between aviaries or lofts, the better. Again, designating the appropriate tools, designating the boots, least susceptible in terms of order of operations, and never commingling birds together. So it sounds like you're saying, they'd be set in segregated spaces. Never commingling the birds would be ideal. In other words, the greatest distance possible would be ideal, Philip.
Okay.
you ever found a battery or a motor in a pigeon? Maybe a little antenna?
A battery motor, I have not, but it's like on occasion they can consume, right? They use pick up a lot of grit from their environment. So you can find some interesting things sometimes. You don't want to find metal shards or metal bits because that can cause some poisonings.
Okay.
But usually, it's kind of interesting for the wild ones anyways. It's kind of interesting, the little rocks and things that they pick up. They find some really nice little treasures sometimes.
Sure. I do have a question about, you said you look at other animals as well. I guess, how busy are you, and are all the fees the same? What you want to expect?
Yeah, that's a good question. I mean, we receive anything, honestly, pretty much anything. We from dogs and rodents and rabbits to horses and giraffes and we've got stingrays before from aquariums. So we do everything, and the fee basically varies. I'd say the larger the animal, the more expensive it will be, and a lot of that cost is a requirement, or a lot of that cost involves disposing of the body of the carcass. So if you can imagine, we get the 800-pound horse, 1,000-pound horse, we got to get rid of that body after we're done the post-mortem, and so that's a lot of the cost. Incinerating the carcass and disposing of the carcass. I'd say
do it safely if it's sick.
Oh yeah.
Yeah, no, that's exactly right. I mean, there's obviously if it had a zoonotic disease, we probably would dispose of it a little bit differently. But I'd say our rates, as Philip was mentioning, our rates are pretty cheap. And the reason they're cheap is we do want to attract business, but because this is a teaching hospital. So, when I was doing the pigeons, there were students that were there that were involved in helping. And so, I'm teaching the senior veterinary students and teaching residents while doing the cases. And so we want to attract a lot of case materials so that we can, train the next generation of veterinarians appropriately.
Very cool.
That's interesting about the avian flu, because they had the National Pigeon Show was going to be in Texas, and the Texas Health Department said they were going to destroy any birds that got brought in, and they shut it down because they were scared that all these pigeons were going to have that. And you hear a lot of pigeon guys say, oh, they've done tests where they've injected avian flu right into a pigeon and it's been fine. And so to hear you say that they're pretty resilient, against it, that's pretty good, because they just kind of draw a line in the sand and say all birds. There's an outbreak right now, so there's no more pigeon shows and stuff like that. That is good to hear that they're at least resilient against it. The other part, what Chris was alluding to, is, have you seen that whole birds aren't real movement thing where they're just trying to see if people will believe anything?
Oh yeah, I've seen it. It's been going on for a while though, right?
yeah. We actually, I reached out to that guy. I never heard it back, but we got you on here. You're the real deal. You've cut open pigeons, and you've never found spy satellites underneath their wings and stuff like that, right? You can clear that up right now. Pigeons are real, right?
That's where that was coming from, Chris. Yeah. I have not seen any battery powered or plug-in cords or anything like that on any of them so far. So.
Yeah. Well, I think they charge wirelessly, right? By sitting on the power lines. Is that how they do it? Oh, yeah. That's wild. I saw that vein one time and I couldn't believe it. But no, this is great. I really do think that, I don't know, worst case scenario, if you got birds dying and you can't figure out what it is, search pathologist and, kind of go that route. I definitely took a lot of different routes to get to where I found you. But, really try to search this specific, find a diagnostic pathology center somewhere at a university. Like you're saying, if, you got something going where you guys are teaching students and stuff, and the price was, totally worth it, because I had to figure it out. I think this would be a good thing. And even if you don't, if you do find one and you have a bird that, dies, age or whatever, just take your bird in and see what they have to say about it, because it's very thorough and it definitely informs you about your flock's health. I think it's a really helpful tool, and it definitely helped me. Like the books all say these are the steps you take. Look at the droppings, look at the symptoms, go to your book, find common diseases. If you're vaccinated for this or that, you can eliminate those. And like I said, I was just going in circles, and it did say most of the time when I read the books, it says to take it to a pathology center. but it was just kind of in a book. So I was like, well, I'll just try to figure it out. That's, and then when I was talking to my mentor, he was like, you really got to do, just take a bird in and they'll tell you what it is. And you guys did that and more. And I definitely appreciate it. It was really helpful for my situation. I'm happy to finally get back to, like I said, breeding birds and, just doing the thing without having to worry about this anymore.
Yeah, it's great to hear that things have resolved. Yeah, things are looking bright on the horizon there.
Jason, thanks for coming on and giving us some details on this, and thanks again for helping me with my situation, especially, man. I really do appreciate it. I hope that people take advantage of more people in your field, because it's really good, helpful thing for any pigeon fancier to have as a tool.
Yeah, no, I appreciate you asking me to partake tonight, and I'm glad to hear that your situation's under control. And feel free to pass along, our web address or our location, and we'd be happy to interact with more pigeon fanciers.
Oh, I've definitely shared Midwestern University with a lot of the guys up here in Arizona, and I had a friend who was going through some stuff, and he asked me, "Where did you take your pigeon to?" And here, man, this is the place, because it's hard to find. So I think the key is, like we said, specific searching. Getting that specific, diagnostic pathology center. So yeah, we'll definitely pass that along. Thank you, Jason. I appreciate your time.
No problem. Thank you. Nice meeting both of you.
Hey, thanks, buddy.